Thank you for joining today's conference call with Governor Andrew Cuomo. I will now turn it over to Governor Cuomo.
Good afternoon, guys. Guys being gender neutral. I'm joined by Melissa DeRosa, Rob Mejica, Beth Garvey, Gareth Rhodes, Dr. Zucker. Today is day 258. We did 200,000 tests yesterday. That was an all-time high on number of tests. It's amazing when you think that when we started, we could only do 500 tests per day, and we had to develop that capacity. So it's really extraordinary. Overall state with the microcluster zones included, 2.6. That's down from 2.9. State without the microcluster zones, 2.2. Microcluster zones, 4.5. That's down from 4.8. 24 New Yorkers passed away. They're in our thoughts and prayers. 1,700 hospitalized. That's up 60. 331 in ICU, 137 patients intubated. The only shift we have today is Rockland County was an orange zone in the microclusters. They have made good progress. Congratulations to Rockland. And they go to a yellow zone. So they have gotten their numbers down. And that is good news. The bad news is, well, the other good news is New York State's infection rate is one of the lowest in the United States. The bad news is we are in the midst of a sea of COVID rising around us. You look at the international numbers, and they are frightening. Countries are closing down. France has a problem. Italy has a problem. UK has a problem. Worse than ours. Those places are locked down, but people are still getting on planes and flying into this state and this country. You look at states around the country, and the numbers are all going up quickly. Texas, 10%. Illinois, 12%. Arizona, 14%. California, 4%. Ohio, 10%. Florida, 7%. So that's a problem. The states immediately surrounding us, our neighbors, Connecticut, 4%. Jersey, 6%. Massachusetts, 2.7%. Pennsylvania, 19%. New York is 2.6%. So the COVID numbers internationally are rising. The COVID numbers nationally are rising. The COVID numbers on our surrounding states are rising. You cannot defy reality, and reality is the virus transmits, and the virus is mobile, and we're in the holiday season, and people will travel more. Thanksgiving, Christmas, Hanukkah, Kwanzaa, holidays, winter, more people inside. These are all elements that conspire to increase COVID. That is the fact. The numbers are going up. The numbers will go up. I take that as a fact. There is a vaccine on the horizon, but it is a further horizon than most people think. If it takes 6 months, 9 months, to distribute a vaccine. I think we're talking about that range. You cannot sustain a rising COVID rate until you have a vaccine. If that is an operating assumption, that is wrong. To the extent people say, well, vaccine is right around the corner, so we can start to relax because the vaccine is here. The vaccine is not here. The vaccine is on the horizon, and you cannot take this rate of increase and survive pending the arrival of a vaccine. You have this level of infection rate, it's even going to make the vaccine distribution harder, right? Vaccine distribution, you have to bring people together. They have to be on lines. They have to be in waiting rooms. So this is all going to complicate it. We have been working with our surrounding states, and it's even more important than ever, especially since our surrounding states have higher infection rates than we do. We set a policy, but these state policies impact surrounding states. I made this point early on. We make a move with our bars. We close down our bars, but the New Jersey bars are open, so then you go to a New Jersey bar. New Jersey closes their bars, so then people come to New York to go to a bar. We know the places of spreading are bars, restaurants, gyms, mass gatherings, and new problem of indoor house gatherings, house parties, seemingly innocuous Halloween party, football watching party, right? And I'm sure we're going to start to see Christmas parties and Hanukkah parties, etc. So that is all a problem. We call it living room spread. Living room spread. Living room family spread. Well, I'm just with my family. My family would never infect me. Your family's not in control of it. Certain members of my family that may infect me purposefully, but put that aside. Just because of your family doesn't mean they're safe. It's not that they're doing it intentionally, but your family is no safer than any other group of 10 people. So that's the situation we're in. I believe this situation is going to continue to deteriorate over the coming weeks. I think you'll see an increasing rise in the number of cases. I have called my surrounding colleagues, governors, and we're going to have an emergency summit meeting this weekend of the 6 northeastern states, governors, and their staffs. The teams have been working together. We want to make sure that we can align policies as much as possible, or at least be aware of what the other states' policies are. The ideal is alignment. That is not a reality because different states do have different situations and they're in different positions. But we believe we're going to have to be taking additional steps, and to the extent we can share information and align action, we'll do that. I spoke with Governor Murphy and Governor Lamont today, and we went over a few issues. But the restaurant policy, bar policy, airport policy, travel, quarantine, right? Because if you don't like the policy in New York, you can fly into Newark or fly into Connecticut. Gyms, we're trying to, and even house parties, because if you don't like the house party policy in Connecticut, you can just go to your friend's house in New York. So We had a conversation this morning. We'll have a emergency meeting over the weekend where we talk about policies. We all just made changes yesterday and the day before. New York basically aligned with Jersey on bars and restaurants with a closure at 10 o'clock. So we're not going to make any changes today or over the weekend. We want to see what effect our changes, policy changes we just made, if they have any effect over the weekend. And we'll have a joint discussion over the weekend, and then we will see where we are on Monday. And with that, I will stop, and any questions would be my pleasure. If not my pleasure, my obligation and my duty. Operator, if you could take questions, please.
Yes, sir. As a reminder, to ask a question, you will need to press star 1 on your telephone. To withdraw your question, press the pound key. Again, press star and the number 1 on your telephone keypad. Please stand by while we compile the Q&A roster. Your first question comes from the line of Zach Singh from NY1. Your line is open.
Hey, Governor. Good afternoon. How you doing?
NY1, how are you?
I am good, thank you. The mayor has said that he could close schools as soon as Monday. I want to get your reaction to that. Can he do that? I know he's laid out that 3% metric to automatically do it, but some parents are complaining that with the rate as low as it is in schools, that should not be the first thing to close. It should more likely be indoor dining, for example.
Yeah. Schools, well, we just reduced indoor dining, first of all, right? We're closing it at 10, only takeout after 10, and we're only at 25% on indoor dining. In New York City, we were anticipating going to 50%. We didn't do that because the rate went up, right? So we didn't go to 50. We stayed at 25, and then we just added the additional restriction of it closes at 10. And you're right, the infection rate in schools is low. Remember what we did statewide on schools was we set general parameters that local school districts must be within. And I want to say, what was the top number, Melissa? Do you remember what the...
It was 5% to open and then 9% yielded automatic closure.
Yeah, it was 5 to 9. But we left it to local districts to work with their parents and teachers to come up with parameters for their local school district, as long as it was within those parameters. New York City came up with 3%, and the schools would close at 3%. And that's why when the mayor says they may be at 3 and 3 triggers closure, that is the agreement that New York City announced. I would hope that the mayor and the teachers and the parents work together to open the schools. If you close the schools, to open them as quickly as possible. The infection rate in the schools is not the problem. The infection rate in the schools is very low, and we're seeing that all around the state. The problem is not coming from the schools. It's coming from the bars, the restaurants, the gyms, and the living room family spread, which is another new COVID term, has to go in the COVID dictionary. So if, in fact, you do close schools, I would urge the mayor and all involved to open them as quickly as possible. If that means reestablishing the agreement and the parameters, then so be it. If that means setting an infection rate in the schools on top of anything else, I think that would make sense, because that's what you're really concerned about, right? Is if you convene children in a school, it will spread. Well, then it has to exist within the school. So I get the parameter of 3% or citywide spread, but how about a indicator of spread in the schools themselves? And I would suggest that the mayor and the teachers union and the parents consider that, because if schools were opened, I think it would be better. Now, remember, this is also, on top of this, Zach, we do have cluster control, if you will. So when we see a microcluster, the state then comes in to close schools, right? We had the red zone in Brooklyn and in Queens. So that's separate. This has nothing, and that stays in place. So if you did see a dramatic spike in an infection rate, you do have that red zone protection where the state would step in and close the school. Next question, operator.
Your next question comes from Luis Pierre from NY Times. Your line is open.
Hello.
Oh, sorry. Can you hear me now?
NY Times. How are you?
I'm good. How are you?
When do we go back to Puerto Rico?
Hopefully soon. So, Governor, even though New York keeps, breaking testing records statewide, we saw that today with 200,000 tests, we're beginning to see reports of very long lines in the city, sometimes hours at testing sites. And it appears, for example, that CityMD is closing early in the city now because of so much demand. And, I'm wondering, we're already 9 months into the pandemic. So what exactly appears to be the problem in terms of getting a test right now? And what can the state do to address the issue?
Well, let me ask Gareth, who's our testing czar. But yeah, something doesn't sound right, because there is no state in the nation that is doing more testing per capita than this state, right? Per capita. So even adjusting for population, we have more testing sites, and we are doing more testing than any other state. So it just doesn't figure, right? How can you have more testing sites and be doing more testing than any other state and have a problem, unless the problem exists in every state and is worse in every other state? But Gareth, do you have an idea?
So we now have over 1,200 testing sites statewide where someone can go on our website and get a testing appointment. Over 425 of those are in New York City. So people, where there might be delays at certain sites, there are other sites that are operating without delays and that have capacity. We have our state-run sites in New York City still have capacity, and we have plenty of reports from other of these 425 sites that have open appointments on a daily basis. So people should go to coronavirus.health.ny.gov, put in your address, and find test sites near you, and just call ahead and ask what the wait times are, and you'll find that many do still have open appointments on a daily basis.
Operator, next question.
Your next question comes from Jennifer Ligg from wabc-tv. Your line is open.
Good afternoon, Governor. You said just a short time ago that the problem really isn't in the schools. Upstate, we haven't had much transmission of COVID in schools at all, yet it's the schools in the yellow zone who are being asked to step up their responsibilities by now adding this testing requirement. Why not have the testing requirement be for the problem areas instead?
The testing requirement is for the problem areas. A yellow zone is a problem area. it's not as big a problem as an orange zone or a red zone. But by definition, a yellow zone is a problem area. It means there's a higher rate of infection in those families in that area. So there's a higher likelihood a child from those households could be infected. You know, by definition, that's what yellow zone means. That is the problem area. And that is, when you look statewide, the worst problem area in the state, the worst neighborhoods by problem in the state are the red zones. Second worst are the orange zones. Third worst are the yellow zones. And you're talking about probably the top 2 or 3% in the state with the highest problems. That's what it means. If you're in a red zone, yellow zone, or an orange zone, you are in the hot spot in the state. Let's do one more, operator.
Yes. Your next question comes from Andrew Stiff of WNBC. Your line is open.
Oh, I don't want to talk to Andrew Stiff.
Governor, good afternoon. You have reminded all of us that it's not up to the local jurisdictions to open or close schools. So in this case, why are you not stepping in and overruling Mayor de Blasio on the New York City schools decision, given that there hasn't been transmission in schools? Why not step in, say, keep these schools open, and let's see if the measures we've imposed in other aspects of society work?
Well, because on schools, you are right. By law, in this state, the state overrides all localities on all rules pertaining to COVID. The rule that the state made here was we set the parameters of 5 and 9, and I said to the 700 school districts, if you are between the 5 and the 9, then we agree. And the city's agreement falls within that. So that is in compliance with the state regulation. We did not say there was a specific infection rate within the school. We didn't set that. We set the rate for the jurisdiction. This is now a new question. Well, should there be a second component where you have an infection rate for the jurisdiction, but then you also have an infection rate for the school, right? And I'm saying I'd like to see schools reopen, and I would be open to that, where it's a different, more sophisticated calculation that says we're not just going to look at the infection rate in New York City or in Erie County, but have a second factor, which is the infection rate within the school. I would be open to that. And I would encourage the mayor and the teachers union and the parents in New York City to consider that, to reopen schools, if in fact they do close the schools. Okay, happy Friday, and have a good weekend. I may see you on Sunday. I've been working on an issue that's very important that I would like to address on Sunday. So I don't know if any of you work on Sunday or follow Zoom on Sunday, but I wish you a good weekend. Thank you, guys. Bye.
Ladies and gentlemen, this concludes today's conference call. Thank you for participating. You may now disconnect.